My name is Emily. I'm the medical assistant here at Physical Medicine and Rehab, and I communicate to our families and patients in a way that they will understand every day. The patients will come in and we give them a medication list to review to see if we are current on our electronic medical record. And oftentimes there will be some medications on there they're really not sure of what they are or if they're still taking them or not. So I will review those medications with them, and I will try to figure out all of the names for the medications because there's so many for each medication. And if they're still not sure what it is, I'll use the reference information to find out what the medication is used for. And if they're still not sure, I will go into the medical record and find out when the medication was added to their medical record to see if there was something going on then that would jog their memory to see if they're still on that medication. And oftentimes they will, between all three of those, figure out if they're still on that medication or not. And I also make sure that they know what they're here for that day, be it x-ray reviews or MRI reviews, or if they're a new patient to one of our doctors. And they're always very appreciative, and I always like making them more at ease.
One of my most memorable experiences here at Rutland Regional Medical Center was many years ago. I worked on orthopedics, 3 to 11. And one of my jobs was, when I started my shift, was to come in and do vital signs on all the patients. So one particular room I walked into, the family looked up at me, the parents and the son, and all of a sudden their mouths dropped and they looked like they were upset. So I was getting the patient's vital signs and carrying on, and it was really quiet in the room. And nobody was saying anything but me. So I said, is there anything else I can do for you? And they're like, no. So later on in the night, I was going down the hallway, and the mom stopped me in the middle of the hallway and said, I'm really sorry that we were all staring at you, but you reminded us of our daughter that passed away recently. And I just realized that you never know what somebody's going through or what they're thinking. So I learned from that moment on to be just really kind and patient, especially when people are upset. There could be another reason, and in this case it was, and I just thanked her for telling me that, and that, I was really sorry that they had lost their daughter, but had she not shared that story with me, I never would have known why they were upset. So you just never know what, somebody's thinking or going through. So be kind and patient to, the patients and each other, or, your coworkers, because they matter too, because that's part of your team.
I'm Mary Beth Alberico. I'm a registered nurse. I provide nursing support to the Physical Medicine and Rehab department here at the hospital, and I'm also the clinical nurse manager for the VOC Spine Care program. So I care for my patients the way I would like to be cared for. The way I would expect my family members to be cared for, in a very compassionate and professional way. Often the patients that I speak to are experiencing a great deal of pain, and with that comes a pretty high level of anxiety. And when I'm speaking with patients, I make every attempt to try to decrease their anxiety. I think this does a couple of things. It really helps to develop a working relationship with the patient, and it also, I believe, decreases their pain level. It takes a really good team to provide excellent care to our patients, and I really feel that the team that we have through the Physical Medicine and Rehab department and the VOC Spine Care program is exceptional. And I really believe that without them, these patients couldn't receive the care that they do receive. And I really feel proud and privileged to be able to work with these folks every day.
In my position in physical medicine and rehab, I speak with many patients reviewing their upcoming procedures, explaining in detail what they can expect from beginning to end. Many of these patients have never had a procedure and are very apprehensive and fearful of the unknown. I try to put them at ease right from the start, reviewing their specific procedure that has been ordered by their provider. I always end my conversation with, is there anything else I can answer for you? And also give them my phone number in case they have a question that may pop up or if they have any other concerns.
So one part of treating every patient as my own is escorting them or helping them get where they need to go here in the hospital. Often I'll be out in the halls and see patients that not only look a little bit lost, but I can tell that they're most likely feeling anxious about where they're going or why they're here. So if I can take a moment to walk them from point A to point B and help alleviate a little bit of that anxiety, I certainly want to do it. I also find that when I'm doing that, I take the opportunity to maybe distract them a little bit, ask them where they're coming from, or maybe just strike up a conversation about just something, small talk, the weather, whatever, just to distract them and make them forget why they're here for a moment. And sometimes it takes a good few minutes, 5 minutes, to get from point A to point B. And by the time they get there, I like to feel like maybe I've, set them at ease just a little bit. And that's how I try and treat every patient as my own.